The one military hospital in Tshwane is in a sorry state. And Deputy Defence Minister says the hospital is facing serious financial and capacity problems.
The hospital needs to be upgraded, needs to be refurbished, needs to be serviced so that it can operate like a hospital. This hospital has got a rich history, and we cannot allow it to go down like this just because of the defunding of it. But so far what I've established inside is that they are using certain floors which were upgraded during the COVID, which are in a state, in a good state. But as far as other first floors and others, they are at standstill because everything is still, there's still a legal argument between various groupings.
The hospital woes are not new, according to some lawmakers. The challenges have also been costly without any financial accountability.
The rot began when billions of rands were pumped into a so-called refurbishment program. Now we're talking 25 years ago. It was called the 10 million rand or 10 billion rand repair and maintenance project. The abbreviation for that was RAMP. And quite ironically, in Afrikaans, it's RAMP, which means catastrophe. Now, 25 years later, there's nothing to be shown. And the question is, what has happened to the money? And every time there is an inquiry as to the state of one military hospital, we are told they don't have money. However, the Department of Defence itself very often gets very upset with us when we ask them about their expenditures.
One health aspect has questioned the competency of those entrusted with leading the facility.
The problem doesn't really lie with the Defence Force personnel on the ground. No, not at all. It is in the management, which is either incompetent, it's corrupted, or it's inappropriate for the kind of responsibility it has. You can't blame the personnel any more than you can blame the health professionals in our public health system, who also experience this decrepitude, this degradation through the terrible management of the public health service. So this is not surprising. I think the Deputy Minister should take a deep breath in and accept, and he was there for a while, he should know this has been happening for the last 20 years. So no surprise, it's just another indictment of very poor governance.
The Deputy Minister says craft-fighting agencies might be roped in to update Treasury on current investigations.
We have now the second meeting pending, wherein we finalize our priorities. This hospital is one of those institutions we have prioritized. So I'm not worried much about that now because we are talking to the National Treasury. And also in that meeting, we may invite SIU and NPA to tell National Treasury where are they. Remember, these are legacy things we have inherited, but we are not folding our arms, we are addressing them.
Billions have been spent already, but the facility is far from operating to its full capacity. Anti-corruption agencies say they are at an advanced stage with their investigations. For Newzroom Afrika on Channel 405, I'm Ziniko Mhlaba in Pretoria.